Our next speaker is Catherine Jonas. Catherine Jonas is a licensed marriage and family therapist and board-certified expert in trauma stress. Specializes in working with patients, their families, to help them cope with pituitary conditions. She works with the Department of Neuroscience's Pituitary Center at Cedars-Sinai Medical Center under Dr. Shlomo Melmed, Vice President of Academic Affairs. Her role has been specifically designed to help patients who visit Cedars-Sinai for treatment with pituitary conditions. The center is focused on multidisciplinary approach to treating pituitary conditions, encompassing not only diagnosis and treatment, but the psychosocial aspects of how the condition affects the patient and his or her family. As a psychological consultant, she is responsible for a number of patient support groups and leads courses on coping skills. She provides therapy and community resources to patients and families. She speaks extensively on pituitary-related illnesses such as Cushing's and acromegaly, helping both the patient and his/her support system. She also is a consultant with the Department of Human Resources at Cedars-Sinai, providing critical incident stress management to employees who are affected by in-house or local traumatic situations. In addition to her role in the Department of Neurosciences and Human Resources at Cedars-Sinai, she is a certified geriatric care manager and runs her own geriatric care management and counseling company in Los Angeles called CJ and Associates Care Consulting. The company helps those with neurocognitive disorders such as dementia, stroke, and Parkinson's disease. Catherine has been on our board of directors. She is a leading support for patients with acromegaly. And Catherine, after you. Here. Here's this, forward, reverse, pointer, or you can use this. Thank you.
Okay, hi everybody. Good afternoon. Okay, so I was told that I need to stay in this little box. So I like to sometimes move around the audience, so I will be mindful of that. And I think what I want to do is changing the glasses. Well, first, before we dive into the slides, I'd like to just I always like to see who my audience is. Can I get a raise of hands of those that have, if this is their very first time coming to an acromegaly conference? Wow, look around. There's a lot of new people. Amazing. We welcome you. And how many of you in the audience are supportive family or care partners that are here today? Amazing. Thank you for being here. Okay. Have I missed anybody? Pharma here? Thank you, Pharma. We need you. Thank you for all you do for our patients and making their lives better. All right, so we're going to dive in here. So we're going to talk about mental health issues in dealing with acromegaly and the word navigating challenges, okay? Which is a key word because we're really going to look at the terrain, if you will, the emotional and psychological landscape and terrain of this illness and how we can navigate it. Now, my slides today are from my personal and professional experience working with my clients in Los Angeles and a few throughout the world. I always like to say when I start my presentations, take what you like and leave the rest. See what touches you, what you connect with, what may be useful, and bring that back home, bring that to your life, bring that to family members, and bring that back to your treatment teams. All right, so why is this topic important? So when I started at Cedars-Sinai years ago, Dr. Shlomo Melmed came to me and asked if I would run his support groups for pituitary patients. Well, the first thing I had to do was review where the pituitary was, right? Because we learn about that back in health class, if you ever learned about it. And I certainly had to Google acromegaly like 20 years ago. And so throwing myself into that, really wanted to be able to find out what this was all about and who these patients were that were dealing with this, and coming from a place of not being educated at all. And one of the first things I wanted to speak with my clients about is that you are going to be faced with this diagnosis, especially if you're early in the process of this, but also knowing that you're not your diagnosis. And I think for anybody that's new in this, you immediately relate or have to connect to what that diagnosis means and kind of wrap your world around that and make sense out of it. Can I get a show of hands? Is there anybody within the first year of being diagnosed in the audience? Okay, so we have a few hands, okay. Thank you for being here, by the way. And I always want to say, please connect with those who've been in these rooms longer because they've walked your path. So you're not your diagnosis. What we're going to learn today is that the physiological and psychosocial aspects of your life are connected. We're going to talk a little bit about that. We're going to talk about coping mechanisms, which as a psychotherapist, I'm particularly fascinated by the clients that I have and how they cope through life. And then I want you to learn more about who you are today and the life you want to live. So if we look at, kind of the topic again, and we look at what your psychosocial stressors are. Does anybody know what I mean by a psychosocial stressor? Anybody have an idea? Anybody raise your hand? Yes, gentleman in the white. Yeah, exactly. So a psychosocial stressor is having a baby. Doesn't have to be considered like a negative or a positive. That's a psychosocial stressor. Facing a new diagnosis is a psychosocial stressor. Okay? So the stressors that come into your life. And I'm going to move on to the next slide here. Are we at goals? Perfect. So the goals of this presentation are to identify what those are for you. Everyone's going to have different psychosocial stressors at any given time. So I want all of you in this audience, and this presentation is really designed to not just the clients in the room, but their care partners and also pharma as well, because we're all wanting to do a better job. So think about what those are, and any social challenges that are getting in your way. Is acromegaly getting in your way of social invitations, challenges? So when we look at psychological or psychosocial challenges, we're always faced with, in the initial aspect of this and navigating this, is confronting a diagnosis. So immediately, personal security is interrupted, right? You're going along your path of life. You may have had symptoms, or depending on what your story is, and all of a sudden, something happens. You're all of a sudden seeing doctors. You're going through tests. You're having labs done, imaging done, and you land at this new kind of plateau, if you will, and are facing a diagnosis. How do you incorporate that into your life, into your work? Are you a mother? Are you a father? Have you just started a new romantic relationship? How does this maybe change your relationships socially, occupationally? Do you tell your boss? Do you tell your coworkers? And how does this change affect how I see myself? There's going to be psychological challenges along your path of life, like all of us. And your path of life is dealing with acromegaly. And so you're going to be faced with these challenges, choices along the way, doctors to choose, procedures to go through. And how do you deal with all of this? What if you decide to have the procedure, like many of you do, and then you're faced with medications? Which one do I choose? Which one is right for my body? How do I incorporate that in my life? What about side effects? So dealing with all of that, breakthrough symptoms. And how do you manage treatment modalities or a medication and you travel? What if it needs to be kept frozen? You know, what if your life doesn't work along with the medication regimen you're being told to do by your doctor? Your doctor, he or she's not in your shoes. You may see your physician in the exam room, but then you come home, right? They're not there with you. So you have to manage all of this. So what's your attitude toward dealing with this? We're going to talk about social and occupational challenges. So these are some questions I always just kind of like to throw out there to the audience. Just take those questions within and see if they connect with you, see if they ring true. Since my diagnosis, or maybe you're years out from a diagnosis and you're maintaining, you know, have I changed in my relationship with others? Am I isolating? You know, do I not want to sit with others at a conference during lunch because I'm new and I don't know anybody? Do I not want to go to that wedding of my cousins because what are people going to think of how I look? Am I turning down social activities? Am I pulling away from work commitments? So as I shared, I'm always fascinated by coping mechanisms. Everybody's coping mechanisms, whatever helps you get out of bed, whatever helps you get through the day, right? It doesn't have to be large goals, you know, that we're trying to attain. Maybe it's just getting through the afternoon. So coping strategies, this is just a kind of a high-end definition, refer to the efforts, both behaviorally meaning the actions we take, and psychologically, how we think about them, that we use to master, tolerate, reduce, or minimize a stressful event. Remember, try not to label stress as good or bad. Having a baby can be a glorious event. It can also be very stressful, right? So in my line of work, I've identified 5 primary coping mechanisms, which I work with many clients today. And we kind of look at the situation in a client's life and how we can utilize each one of these coping mechanisms at any given time, even though the situation doesn't change. So as I'm speaking, think about a situation in your life. It doesn't have to be about having acromegaly, anything that you're dealing with right now. The goal is to be aware of how you cope with your stressors in your life at all different times. So let's talk about some of these coping mechanisms. There's one called the fighting spirit. This is where you see the illness as a challenge. You have a positive attitude towards the outcome or towards the progress or process that you're making. You are an active player in this. You are your own advocate. And you exert some kind of control over the stressors. That's a coping mechanism. How many people have ever been in that coping spirit? I don't see as many hands as I'd like to see. I know everyone has been in that moment. I'm not saying you're living in the fighting spirit. We're not, Wonder Woman or the Bionic Man, but there are periods when we are there. So believe it or not, avoidance and denial are coping mechanisms. Has anybody ever heard of denial? Okay. Now, honestly, I used to think denial was very black and white. Either you're in denial or you're not in denial, right? I used to think that way. Well, guess what? As a professional, I've even changed my view about denial. Denial is fluid. You know what I mean by that? You can kind of be in denial a little bit, and then you can move out, and then you can go back into it, right? You don't have to be 100% in. You can be 55% in. Denial is a coping mechanism, avoiding things in life, a difficult conversation to have with your partner. That is a coping mechanism. We deny the impact of the illness, the threat of the diagnosis, we minimize it. This can lead to unhealthy consumptions of, dysfunctional kind of eating, drug use, pick your, demon out there. And it can lead to mood disorders. Fatalism is another coping mechanism where you just don't think it's a big deal, right? Passive acceptance. It'll go away on its own. Anyone ever been in that? Just a little bit? Not dealing with it a little bit? People ask me, well, how can you identify helplessness and hopelessness as a coping mechanism? It doesn't sound like you're coping at all if you're in those kind of mind states. But believe it or not, sometimes we just need to kind of go to that place. Has anyone ever felt helpless or hopeless with having acromegaly? Anybody? Yeah, overwhelmed and called, what do I do? Is there anything that can be done? My life is over. I'll never meet someone. No doctor will ever understand me. Why am I going to my doctors and having to educate them? Anyone ever feel that way? So this is probably it's actually a coping mechanism of mine at times. I'll go to being anxiously preoccupied. Has anyone ever gone on the internet for hours and just searched, right? Looking for anything, finding anything at all. Compulsive searching, reassurance. Time is spent worrying about this coming back. Uncertainty, right? I can't cope without knowing what the future holds. Anyone ever been in that? A little bit? Okay. So we want to look at controllable versus uncontrollable stressors. There are things that you can do to control things around acromegaly that can make you move into that fighting spirit again. For example, I want to be able to pick my healthcare professionals, ideally if I can, or at least connect with people like Jill or someone in the room if I'm in a small town and nobody knows what a pituitary is. Maybe we can help support you getting you to a medical center. And then what procedure is best for me? What do I need to do? There are things that we can't control in life. We know that. The fact that acromegaly is part of your life path and the fact that you need treatment. So how do we cope with kind of controlling those stressors? Well, we can utilize things like problem solving, coming to these conferences, making smart decisions, wise judgment calls. We want to be that active player. Get involved, volunteer, reach out to somebody. For those of you that have been coming to these conferences, reach out to the people where it's their very first time. Be of service to others. Well, how do we cope with things that are uncontrollable? That's where it's most difficult. And that's where we want to become aware of our emotional responses to things that we can't control. I'm going to say that again. We want to become aware of our emotional reactions to things we can't control. How about the other person? Right? How do we manage just being in relationships in general, let alone dealing with breakthrough symptoms or acro fog or acro rage or, having to get more labs and, you're terrified of needles. There's a lot of having to cope with things that you can't control. So this is where, and I know a lot of you are utilizing this already, having to find activities that give you pleasure, mindfulness, breathing techniques. I know a lot of you are utilizing that, as I mentioned, to kind of cope in a way with things that you can't control. So what about managing symptoms? So you're faced with this big diagnosis that something's, growing inside your head. You have to then decide what to do about it, and then you're faced with medications, and then you're faced with all these, symptoms and side effects. And so how do you deal with the breakthrough symptoms? How do you deal with the body aches and the fatigue and headaches and such? And I know that we work with pain specialists. We work with people that specialize in mindfulness. We work with nutritionists. You're going to hear a nutritionist, after I speak today. So how do you utilize those resources to getting through the day? So Acro Rage, anybody heard of Acro Rage? Yeah, acro fog. It is true, it is real, it does happen. And it's something that our people are constantly dealing with. It's important for those of you in the audience, if you're struggling with these, to talk about it with others, and mention it to your physicians. I think it's really important so that they understand this part of what you're dealing with. I'm going to talk a little bit about a type of theological modality that I use. Psychotherapists in the world of psychology, there's many different ways of working with clients, right? You've heard of Freud, maybe you've heard of Bowen, or different ways of helping clients get through life. Anybody ever heard of cognitive behavioral type work? Cognitive meaning how we think, behavioral thinking how we behave, how we act. The idea is there's a fixed situation that you can't change, but if you change your thoughts about it, it can change how you feel about it, and therefore it can change how you then may take action or behave in your life. So let's just cut and dry here, real simple, diagnosis of the illness. Thought, let's just make it an automatic thought for somebody. This is a sample client. I'll never be the same. What's your emotion? If you're thinking that thought, I'll never be the same, what do you think the emotion is immediately right after that? How about fear, sadness, depression? What I mean by emotion is also feeling. Those are interchangeable words. And then behavior is also interchangeable with the word, what actions am I going to take? Well, I don't know if I want to show up for the work event. The theory believes that a situation not need to be changed in order us to see it differently, think about it differently, ultimately feel differently. And the last bullet, if I change my thinking, I can change how I perceive the situation. Life is full of uncontrollable situations, right? We all know that. You can pick 1,000 in your personal lives today. I'm a big proponent of finding the things that you can have some control over and master those, or learn about yourself by finding how you can utilize some of those choices. So an automatic thought is something that just comes right away. Automatic. Right? It's so well rehearsed, you don't even know where it comes from. It just automatically shows up. It travels so quickly you're unaware of it, and it tends to always precede a behavior and a feeling. It's an automatic thought. We all have them. And where do you think we get automatic thoughts from? Anybody take a guess? Childhood. And it's not just about parents. We don't want to always blame the parents. It's also about the people in our younger years that influenced us. Maybe it was a teacher. Maybe it was a camp counselor, somebody that taught us ways of seeing ourselves or thinking about ourselves. So the idea is, how do you identify these automatic thoughts? And boy, they come up fast. So how about this one? Your doctor's office calls. What's your automatic thought? Something's wrong? Is that an automatic thought for most people? I see a lot of nods in the what if your doctor's office called because they need to reschedule your doctor's appointment? Does that ever happen? Is that your first thought? Maybe it is, but So what's your emotional reaction to that? Yeah, fear, absolutely, when the doctor calls. Oh, my labs came back. Oh, God, Yeah, absolutely. I think we just, as instinctual kind of beings on this planet, we kind of go to that, fight or flight place of, my goodness, what do I need to attack next, right? But my point is just be mindful of that. Be mindful of how you think. So core beliefs are our core. I always like to kind of physically, the core of us, how we think about ourselves. These are underlying assumptions that we have about ourselves. They're usually unconscious. They can impact our impersonal relationships, work relationships. So these are commonly held irrational core beliefs. I'm helpless, I'm weak, I'm inadequate, I'm bad, I'm unworthy, I'm unlovable, I'm different, right? These are irrational core beliefs. We're going to talk about rational thinking as opposed to irrational thinking. I tend to move away from positive thinking versus negative thinking. I like thinking rationally versus irrationally. So if we're struggling with irrational thoughts about ourselves or about a situation, what do we do about it? So just because something is true, or we believe something is true, doesn't mean it's a fact, right? I believe this is true, or I feel this is true, but if it's not based in facts, and that's pretty simple, then it may not be true. So we're going to talk about rational versus irrational thinking. And I'm going to ask you to ask yourself 3 questions. Even today in my life, I have to ask myself these 3 questions sometimes. All right, slow down. Is this rational or irrational? So number 1, are my thoughts based on fact? Number 2, does my thinking help me feel the way I want to feel? So is what I'm thinking helping me feel good, bad, depressed, happy? And does my thinking help me achieve my goals? And again, I'm not talking about lofty goals. I'm talking about getting out of bed. Sometimes that's the goal, right? If you answer no to any of these 3 questions, you may want to challenge that thought that you're telling yourself. You have the choice to keep the thought or not keep the thought. I'm going to share something personal. When I had my daughter 24 years ago, I had this core belief that would pop up all the time that I was a bad mom because I had to work. Okay, so that's 24 years ago, right? So my image of a good mom, she wears an apron and she's baking cookies. So when her daughter comes home, there's the smell of the chocolate chip Nestle's cookies in the house, right? Or whatever it looks like. But that was where did I get all that from? Anybody have an idea? Leave it to Beaver, I don't know, Nestle's, I don't know, good marketing. Wherever I was, however I grew up, right? But was I a bad mom because I had to work? No. Women work today, right? Men work, women work, men stay home today and raise children. But I had that core thought that I always had to constantly question. That core thought is gone today. So just remember, those automatic thoughts and those core thoughts, you can maneuver those to get to a healthier place. I have a daughter today that understands how money's made. It doesn't grow on trees, right? She understands that she needs to work if she wants nice things. So cognitive techniques. So your doctor's called you into the office to update you on your prognosis. You can choose to think, I know it's bad news, or you can ask yourself those 3 questions. Now, all you know right now is that your doctor has asked you to come in. That's all you know, right? So, first question, Is it fact that something's wrong? Second question, thinking this way, does it make me feel better about myself? And third, is it going to help me get out of bed today? Right? So I hope you answered no to some of those. So how about this? The doctor's office calls you to come on in, and what about, I don't know what the news is, but I'm going to be able to handle it. I can call Jill. I can call Daphne. I can call Chris or JD. I could call anybody in this room. None of this is easy. We come into this world and we learn our automatic thoughts and core beliefs about how we kind of view acromegaly or how we think it's going to affect me, my relationships, my partner, how my child or children are going to see me. So be mindful of the thoughts that come into your head and be open to maybe being mindful to thinking differently. So visualization, these have been shown to be extremely effective, almost as effective as actually doing the skill. So, NBA basketball players, women's soccer, pick the sport, they do an enormous amount of visualizations on getting that basketball in the basket or getting the tennis ball over the net, or as far as gymnastics, getting on those high beams, whatever it is, there's a lot of that. And when we talk about, when Jill asked me to speak about mental health issues and navigating those, the term mental health was not used a lot, even 10 years ago. And when I was sitting in the back listening to the speakers, Simone Biles came to my mind with her gymnastics work in Tokyo. And she needed to take a break because she needed to take care of her mental health issues. And I know there was a lot of talk about mental health issues. Well, guess what? We all have mental health issues. Mental health is about how you see yourself in the world today, how you are coping with what's in front of you today, whether it's rational thinking and you're in that fighting spirit, or you're in irrational thinking and you're feeling, fatalistic and you're feeling hopeless. It's really important that anyone that's dealing with an illness, and in this room it's acromegaly, but many of you may have other medical issues, right? On kind of how you're treating these. So we want to be able to stay on top of our mental health, just like your medical issues, just like your medications. So visualization is very strong. Mindfulness is a very strong tool to use if any of you work with mindfulness. It's more of an active type of coping mechanism than meditation, which is really slowing down the mind. And this is one of my favorite quotes in regards to mindfulness, that it's a technique for changing our relationship to our thoughts and feelings, and the perspective one gains from practicing the technique. Sometimes a mindfulness activity that I do is feeling my feet when I walk. When you walk, when you touch the ground, when you're walking down a medical clinic corridor, feel your feet on that pavement or wherever you are. It kind of is very mindful to focus on that. How do we practice changing thoughts? It's practice. You just the first thing I want you to do is just know how you think. Notice where your head goes about a situation. Do you go to that irrational or rational thought? And maybe taking action and doing something in opposite of this. Anything changes through growth if there's desire and repetition. Has anyone ever heard of cognitive distortions? Distorted thinking? We're going to go through these. These are kind of fun. Anybody ever been in all or nothing thinking? Anybody? We call that black and white thinking or all or nothing thinking. We call these cognitive distortions. If I can't do all the things I used to, then life's not worth living. Very all or nothing, black and white, right? You can reframe your thought. I can't do some of the things I used to. Maybe I can't dance, but maybe there are things I can do. Anybody catastrophize? So other forms are making a mountain out of a molehill, right? Catastrophizing. We blow things out of proportion. Now that I have this illness, my life is over. Is it over? Right? Ask yourself those 3 questions. It's not what I planned. It was not in my plan to get acromegaly. This was not part of my life plan. But there's no evidence your life is over, and you can adjust and adapt. Maybe not even accept. Maybe accept is a little too hard. I have a lot of clients that are not willing to accept, but they're good with adapting and adjusting. What about should statements? I should have, I just should have. I just should have. Anybody entertain those? I should be able to handle this without help. I don't want to ask for help. I'm facing a difficult time. It's okay to ask others for help. What about if only? This one's dangerous. You just end up being a victim. And self-pity is a dangerous little rabbit hole to spin in. Anybody ever go to self-pity? Feeling sorry for ourselves? We all do that. There's a time and a place for that, but I just don't want you to live in self-pity. So if only I had called the doctor, if only if I had listened, if only I had noticed that my vision was changing a little bit, if only. So now you have to deal with what's right in front of you to be done. So life is full of stress. It's about how you adapt to it, how you adjust to it, how do you handle it. The small little tiny ones, I'm in traffic, to the big ones, there's a new tumor that's growing inside of me, right? Life is full of stressors. How do I think about what's happening to me right now? What are my thoughts about it? How do I feel about it? What am I going to do about it? You are so fortunate to be in this room. I always like to acknowledge Jill for spearheading and everybody in this room, because we can't be here without you. We need you who are navigating your journey to help others who are new. And I have to be honest with you, there's a part of me that's kind of sad being up here because I'm seeing new people. I don't want anybody to have acromegaly, right? But we're getting the word out and we're educating people. I met 2 men here today that didn't know each other. They're both from the same area of Chicago, and they both have the same endocrinologist. So you kind of wonder, thank you for being here. And for the new people, you are amongst family now. For all those that don't understand you. So I'm going to end with one of my favorite quotes. Watch your thoughts, they become your words. Watch your words, they become your actions. Watch your actions, they become your habits. Watch your habits, they become your character. And watch your character, it becomes your legacy. And your legacy are those that come after you in your family. Okay. Thank you, everybody. Any questions?
I do have one.
Where is this question coming from? The internet, the World Wide Web?
Zoom.
Okay, a Zoom.
So from Jason Myers, what are some good methods for dealing with the ever-present feelings that come with waiting for the tumor to come back and every little symptom is somehow connected to it?
Yeah, hi, Jason. That's a great question. I just want to make sure the audience here understood the question. Jason is asking, how do you manage the in-between times of waiting if a tumor is going to come back, right? Okay, well, first of all, you're in the what ifs as a cognitive distortion. One of my favorite quotes is, be where your feet are. Plant your feet on the ground right now, uncross your legs, everybody, and put your feet, where are you? You're right here. You're in the present moment wherever your feet are, and hopefully you're not being chased down a dark alley somewhere and you're running, but hopefully you're in a safe space. And I think, Jason, what I would recommend is really trying to stay in the present moment and stay out of the what-ifs, staying out of tomorrow, because it's wasted time and it's wasted space. I hope that answers your question.
So I have a question, and I know that we've done this in the past, but especially for the females that this condition affects and the physical changes that it makes, how would you suggest helping to cope with having to deal with the physical changes that the patient is dealing with on top of, the hormonal imbalance and having to look into a mirror and not recognize what is looking back at you?
Great question. Thank you, Jill. We talk about that often. And I think the first thing is, I'm not in your shoes. And so to come from a place of speaking to you professionally, or even if I was in your shoes, how challenging that would be. So I think the first and most important thing is just to normalize and validate that that's got to be very challenging to look into the mirror and not recognize oneself. And I'm speaking to the men in this room also. Women traditionally are faced with how one should really look. We're kind of saturated with magazines and weight and what a body should look like. But men too are looking at their face in the mirror and not recognizing them. And I want to make sure I answer your question because it's a tough one. I think you get the emotional support you need around that, whether it's through support groups and talking with other women. If you're finding that you're more depressed and anxious about those issues of physiological issues of how you appear, maybe seeking a therapist can be really helpful to kind of, again, validate and support all of that. And then I think it just comes from inner work of kind of finding love for yourself regardless. Yeah. Is there another question? Hi.
I was a single mom when I was diagnosed in 2017, and I had, my oldest was 16, and my youngest was 10. I had 4 children. So when I came home, I also homeschooled. They were old enough at the time to know how to get their own lessons out and do their own school. The older ones helped the youngest ones, and I did what I could do. But when I was really down, they were taking care of Mom. So they became adults before it was time. And now, we're not close. I would like to know how to go about rebuilding that bond, because I feel like we've already gone through this stage of them taking care of their elderly mother. Do you know what I'm saying?
I understand. I'm hearing you, yes.
And it's like they feel like if they're around me, I'm going to need help. And they don't want that. And I do need help sometimes, but I want them to feel like they can just come home and see me. But that I want to because they've had to help me so much.
So would you like to spend some time with me a little bit today? And I can talk with you kind of privately too about this and give you some kind of
Sure.
ideas? Because I
Sure.
think you're bringing up an excellent point for the men and women in this audience who have children. Sometimes when you're not feeling well and you're having to spend all your energy taking care of yourselves, you're not really available there for your children or your partner, and even maybe that your children had to take care of you.
Okay.
And sometimes that can be
Thank you.
hard on those relationships. I'd love to talk with you later.
Thank you.
Thank you. There's a hand, if there's time. There's a-
I just want to say thank you because I was diagnosed in 1981. And for 20 years, I had no support whatsoever. I had no clue what was going on. Medically, doctors didn't really know about acromegaly or what was involved. Then we met Jill and we become a part of this community, especially for the newer people in this room. Become a part of this community because it is supportive. Work with Jill and people that are here to help you because, you know, having gone through first 20 years of not knowing any of this, it's just devastating. So this is very helpful. Please use it.
Thank you.